Hi, everyone. On this episode of the Need to Know Show, we're going to talk about nutritional supplements and the role they play in knee replacement surgery. So, in this episode, we're talking about nutritional supplements, and in particular, we're talking about the role nutritional supplements play in your recovery and your preparation for knee replacement surgery. So, when we talk about nutritional supplements, why is this something that we need to consider? Well, the one thing to think about is with knee replacement surgery, there is definitely a prevalence of people being undernourished or malnourished. And this is something particularly common in the more elderly population. Individuals who might not have as much of an appetite, may not be eating as well, may have some cognitive issues involved as well. But it's also something that should be considered for younger individuals and individuals who, you might not think of being undernourished or malnourished. When you think of having a knee replacement surgery, it's a very traumatic experience, a very significant thing that is happening to your body. So you really need more nutrients and more energy and more raw materials for your body to heal and recover. So typically your normal nutritional intakes might not be sufficient to have the most effective recovery or most effective preparation that you possibly can. So when we're looking at the best things, before I do that, let's talk about, so also after knee replacement surgery, you have significant weakness. You have muscle atrophy. You have just decreases in strength. A lot of the studies look at your quadricep muscles, so those big muscles of your thigh, but you're also looking at weakness just throughout your body in general, decreased mobility, all these things that are very important and you're going to need to make a full recovery and to get back to your level of mobility and function and activities. So when we talk about nutritional supplements, we're talking about the biggest things to look at are the macronutrients, so carbohydrates, proteins, fats. In this case in particular, there's some research. There's not a ton of research, but there's some research for carbohydrates. So carbohydrate containing fluids, drinks, things of that nature. And there's also a good amount of research, probably a handful, a dozen or so studies looking at protein supplementation or amino acid supplementation. And amino acids are the building blocks of proteins and the things that lead to trigger muscle synthesis and building up of muscles and muscle strength. So first off, looking at just a carb-containing fluid is what the article I looked at said. So basically a drink or a beverage, a supplement that has a lot of carbohydrates in it. And what they showed is there's an increase in insulin-like growth factor. There's a decrease in hunger. There's a decrease in feelings of nauseousness. There's possibly a decrease in hospital length of stay. And it seems to be potential for attenuating the change and the decrease in insulin sensitivity that can occur with surgery. So it really basically what it's saying is it's helping your body get the levels of carbohydrate, the levels of glucose and sugar that it needs during this period that are going to be necessary to help initiate healing, initiate recovery, and help decrease hunger, decrease nausea, things of that nature, give you the energy you need for recovery. So that's looking at carbohydrates, a carbohydrate containing beverage, fluid, supplement drink. And then also there's a lot of research, well, not a lot, but a handful to a dozen or so different studies looking at protein supplementation or amino acid supplementation. And a lot of these studies are showing that if you take some type of amino acid supplementation, so typically the recommendation seems to be a couple weeks prior to your surgery, so 1 to 2 weeks before your knee replacement surgery, and then 1 to 2 weeks after, at least in that acute phase after surgery, they show there's a decrease in muscle atrophy, so the muscle doesn't decrease in size as much and get smaller. There's an accelerated return of function and mobility, and just increase in muscle size and muscle strength that is associated with this. If you're taking the protein and the amino acids as a supplement, that's making sure that your body is getting both the things that are going to initiate muscle synthesis, initiate muscle strengthening and building of new muscle, and it's also going to just give your body those raw materials, those proteins, those amino acids to actually build the muscle in the first place. So it's both initiating that muscle synthesis, that building of muscle, and it's giving the materials for the actual building of those muscles. So definitely a lot of research, or some research out there, that is promising in the benefits of using some kinds of nutritional supplementation, if that's a carbohydrate drink or beverage, or some sort of protein supplement or amino acid supplement. There seems to be some positive outcomes and some positive benefits to that. And they also seem to show that there's really relatively low risk with taking these things. As long as you're taking them appropriately, the risk is really low, and they're very safe to take as well. So that's kind of the role of nutritional supplementation and where it fits into your knee replacement surgery. There's obviously a lot of things out there about, different minerals, different vitamins, different herbs and spices and things like that are supposed to be anti-inflammatory and help with decreased pain from arthritis and healing. And there's a lot of stuff out there, a lot of things, but when you look at things that actually has some research to really show some significant benefits, you want to look at particularly those macronutrients, the things carbohydrates and proteins and or amino acids are what really has some research to support that they really seem to help with the recovery process. All right, so thank you very much for watching, everyone. This has been the Need to Know Show. Please, if you like this material, want to see more videos, I post daily, click the link to subscribe. And if you have any questions or comments, I'd love to hear from you as well. Have a great rest of your day, everyone. Take care.